Day to you. This is Nurse Antonia. So I may mention about the importance of calcium during pregnancy. So right now I want to explain what happens during birth. What happens to the fetal score? This is a model of the fetal score. That is the score of the baby in your uterus. This is how it looks like, and it has what we call frontal nails. It has frontal nails, that is opening. Here we have one opening here, then at the back we have another opening here, then at the lateral side we have both sides, we have another one and another one here. So the bone of the newborn or the baby in utero, which is called fetus, is usually not closed totally. It's not fused yet because of the birth process. In birth process, there's what we call molding. That's what happens to the skull, the head of the baby. The skull itself, the bone, they override each other. That means one will on top of each other to reduce the size of the head of this baby, so that the head can pass through the birth canal. That is the pelvic floor muscle, the pelvic bone, the cervix and the vagina itself, will finally come outside. So that's the reason for why God created this frontal nerve, so that the bones will now override, they will constrict, override each other, then the head of the baby will reduce seriously, so that they can pass through the birth canal. This head can pass through the birth canal, then the woman will not deliver. You understand? So why I'm explaining this is because I want to still stress the importance of calcium as you are pregnant. So this bone overriding each other, so there's is expanding and contracting. So it actually need to still be strong on its own, by having sufficient calcium, which you, the pregnant woman, supposed to have eaten, taken through diet, through your supplements. That is that white tablet doctor gives you during antenatal, during third trimester. So when this bone are actually strong enough, they can withstand all this process I've explained so far. So because they will override, they will still go back to normal and override again when there's need for it, so that there won't be birth injury, fracture to all these bones. If the bone is too fragile during this process, it's bad to have some fracture. You understand? So don't neglect taking calcium while you are pregnant, okay? Because it serves this purpose that I explained. You understand? Then another thing that goes on during birth process is that when there's a prolonged labor, like when the pelvis, the type of the pelvis of that woman is not roomy enough, when it's not gynecoid enough, maybe it's looking like android pelvis, like the pelvis of a male. So giving birth through vaginal delivery becomes a difficult task, because no matter how this head moves, no matter how it reduces in size, it will not still be able to pass through that kind of shape of pelvis the woman has. So that's why they're actually asking for cesarean section when this is noticed. You understand? When this is noticed, they ask for cesarean section. Okay? So do not see cesarean section as you are too lazy, you cannot give birth by yourself. No, it's another alternative of bringing out this baby safely, so that birth injury will not condemn this baby, or will not make this baby be permanently epilepticus in life, or be permanently turned to a vegetable. You understand? There's some birth injury that renders a child useless, okay, that will make the child to be having a physically challenged. Some have paralysis of the hand, and that, all that, because they've tried to force the baby to come out. Okay, so thank you very much for listening. Please like, love, share, follow my page for more health issues, for more enlightenment about pregnancy birth process. Thank you. Bye.